follows. Let us see about the background, aim and research question, methods, results, discussion, and then we'll see recommendation. So if you have any questions regarding my presentation, hold on your questions. We'll see at the end of the session. Let me start with the definition about what is evidence-based medicine. In 1996, Shakets is the first one to introduce the definition for evidence-based medicine. Evidence-based medicine is a consensuous, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. How to use evidence-based medicine in clinical decision to answer for the clinical problems, he came up with the three steps or three components. The first one is EBM steps. Hereafter, I will call EBM for evidence-based medicine. And this steps helps the physicians to understand how to get evidence which they can utilize for their practice. And the second component is physician preference, which has two more subcategories, which is education and experience expertise. And the third one is patient's perspective. So the integration of all three is the evidence-based medicine. And what are the consequences? What are the positive consequences if they utilize evidence-based medicine in their practice? The first one is it helps to improve the quality of care. When they utilize the clinical guidelines which are basically developed from the evidence of systematic review, if they utilize the clinical guideline, it will help to standardize the medical care. Through this way, they improve the quality of care. And the second one is improvements in the patient safety. This is achieved by identifying the gold standard treatment and diagnosis, which is again identified from the evidence, and this helps to reduce the clinical errors. And the third one is cost-effective healthcare system. Several studies are being conducted in different methods, treatment methods, and the diagnostic procedures, which help them to identify which is cheaper and the effective methods. Through this way, we can achieve a cost-effective healthcare system. And regarding now, we'll see what is the uses, and now we'll see what are the other countries are performing in terms of evidence-based medicine. Here we listed three countries, which is Canada, Jordan, and Norway. The range of positive attitudes on EBM was ranging from 80% to 98%, and the practice of evidence-based ranges from 52 to 70%. And then in terms of what are the barriers to use evidence-based medicine in the practice? A systematic review conducted by Zaltzman, he identified the three main barriers which was identified in majority of the studies. The first one is lack of time for the physicians, lack of knowledge in EBM skill, and less availability of evidence in particular field. So now we'll see what is the situation in Armenia. After 16 years of studying evidence-based medicine, in 2012 they first conducted a conference which is evidence-based medicine in Armenia, myth or reality. The theme of the conference was declaration on the consistent promotion of EBM among physicians and medical students. This was organized by the Medical Scientific Library in collaboration with the Cochrane Collaboration. And the second conference was in 2015, Evidence-Based Medicine from Creative Practice. This was organized by the Yerevan State Medical University, and the main theme was how to develop clinical guidelines and then implementation, how to teach clinical epidemiology and evidence-based medicine, and application of EBM methodology. And apart from these two conferences, there are several online tutorials, like three of them, which is organized by the National Journal, Scientific Medical Library of Armenia, Armenian Medical Association, and Armenian Association of Specialists in EBM. In order to understand how physicians are performing in terms of evidence-based medicine, the study has an aim to compare the evidence-based medicine knowledge, attitude, and practice between general practitioners and specialists, as well as pursue barriers in practicing EBM among GPs and specialists in Yerevan and polyclinics. And we considered GPs and specialists because the previous studies, they mentioned that there was significant difference between GPs and specialists in terms of practicing EBM. To be more specific, to address the aim, we came up with several research questions. Our primary research question was, does the current EBM practice differ among GPs and the specialists? And the secondary research question is, does the attitude and the knowledge of EBM differ among GPs and the specialists? What are the factors that influencing EBM practice among GPs and specialists? What are the perceived barriers of GPs and specialists to use EBM in their practice? To answer these research questions, we came up with a study design, which is a cross-sectional survey, self-administered survey. We aimed at the study population, which is GPs and specialists, practicing in the 21 polyclinics of Yerevan. And we had exclusion criteria, which is GPs and specialists who are not able to speak or read Armenian, because there are several GPs who knows only Russian. And we used a convenient sampling method, and the estimated sample size were 420. We estimated to have 210 GPs and 210 specialists. We had 6 trained personnel to approach the physicians and distributed the questionnaire. The trained physicians with the student investigator, they met the physicians at their office and they distributed the questionnaire, and they collected the questionnaire after the 2 days. If the physicians were busy, they couldn't complete the questionnaire, we again went back after 2 days. Like this, we gave them maximum 5 times time to fill the questionnaire. And then we utilized an instrument which was from the previous studies, and it has several domains, 6 domains. The first domain is knowledge on EBM, which consists 2 more components, resources and technical terms. And the other one is attitude towards EBM and practice on EBM, opinions about the methods to move from opinion-based practice to evidence-based medicine, pursue barrier to practice EBM, and general characteristics of the physicians. With the study got approval from the Institutional Review Board of American University of Armenia, and we performed a single data entry to check for the accuracy. We randomly selected the 10% of the entered questionnaire, and we compared with the hard copies. And as a result, the response rate was, and the physicians, we approached 498 physicians. Among them, 457% agreed to, people agreed to participate, and we had 433 written questionnaire, 213 GPs and 205 specialists, and there were 15 incompletes. We considered them as incomplete if the question was 50%, more than 50% of the question was incomplete, or the physician didn't answer whether they are GPs or the specialists. And this is the general characteristics of the physicians. The mean age was 50. And there was a significant difference between the GPs and the specialists. The majority were female population, and among them, majority were GPs. And the teacher, it was a statistically significant difference. When we asked them about do you teach or supervise medical students, only 8 people mentioned that they teach. And then when we asked do you have any scientific degree other than MD degrees, well, 5 people mentioned that they do have. And the year since graduated, this we asked them to know about their experiences. And the mean year was 23, and the number of patients seen was 13 patients per day. Regarding the knowledge on technical terms, as I mentioned earlier, knowledge has 2 components. One is technical term, another one is the resources. We gave them the technical terms like odds ratio, relative risk, and the confidence interval. There were 16 technical terms, and we gave and there were 4 options. I do understand, explain to understand, explain to others. Some understanding, do not understand but would like to. It will be helpful for the future. And the range was from 29 to 46%. And we calculated the knowledge score. The knowledge score was calculated by giving the points to each. But we combined the response option do not understand, would like to, and the response option of it will be useful for the future. We didn't find any difference in the knowledge in these 2 response options. And the mean person knowledge was 49.46%. And again, there was no statistical significant difference between the GPs and the specialists. Regarding the knowledge on resources, we gave them the list of resources of evidence-based medicine, and we gave them again 4 options, saying that use from a clinical decision and read, and then I know but I do not read, and I do not about these resources. And majority of them mentioned that they do not know about these resources. And there was no statistically significant difference between the GPs. There was mild difference between the GPs and the specialists. And the mean person score was 48%. Regarding the attitude, we had, here we highlighted only the questions which has a significant difference between the GPs and the specialists. And regarding the attitude towards the career promotion of evidence-based medicine, there were 87% of people mentioned that they have positive attitudes or agreed to the statement. And the second one is attitudes of healthcare colleagues. 63% mentioned that they have positive attitudes. And we asked them a negative statement about asking like places and EBM places and another demand. And already overloaded primary healthcare physicians, 51% mentioned that it is an overload for them. And regarding the practice, we consider them, let me explain what is ABM users. We gave them a scale from 0 to 100%. We asked them to answer. If they answer 50 and more of their practice is evidence, then evidence-based, then we consider them as a EBM users. And 62% they mentioned that they are EBM users. In unadjusted analysis, there was no statistically significant difference between the GPs and the specialists. As I mentioned earlier about the scale regarding the percentage of evidence in their practice, the mean percentage was 50 and it ranges from 0 to 100%, and no statistically significant difference between GPs and specialists. Regarding the barriers, the majority of the population mentioned that their main barriers is lack of investment by health authorities, and the next was no financial gain in using EBM, and the language barrier, lack of hard evidence, and availability and accessibility of evidence. These barriers, there was no statistically significant difference between the GPs and the specialists, except for the barrier, lack of personal time. GPs tend to say more that they do not have time. And regarding about the opinions about the methods to move from opinion-based practice to evidence-based practice, we gave them the 3 methods, which is EBM skills, seeking and applying summarized based on research studies, and use of practical guidelines protocols based on research studies. And then we gave them 3 options. This is my current part of my practice. I'm planning to incorporate in the future and not a useful method. Majority of them mentioned that they are planning to incorporate in practice. And there was no statistically significant difference between GPs and specialists. And regarding the formal training, we asked them, like, did you add any training on searching strategy or clinical appraisal or evidence-based medicine practice? 16% mentioned that they add training on searching strategy, and 11% mentioned that they add training on critical appraisal of the article, and 22 mentioned that evidence-based practice. And there was no difference between GPs and specialists. Regarding the multivariate logistic regression, we conducted to see the association between the EBM practice, which is our dependent variable, and our independent variable as the specialist, GPs or the specialist. And then we came up with some control variables or confounding variables. We consider them as control variables if they have significant association between our dependent variables as well as the independent variables. And after adjusting for these variables, we found a significant difference between the GPs and the specialists, and GPs tend to more practice evidence-based medicine than the specialists. And finally, as we compared our studies with the other studies conducted previously in other countries, as I mentioned earlier, 62% mentioned that they practice evidence-based medicine.